Dr. Gary Zammit, the President and CEO of Clinolabs Drug Development Corporation. And with me today is Dr. Eric Siemers, the Chief Medical Officer at Acumen Pharma. Dr. Siemers and I are going to have a conversation about Acumen and the work that they're doing there. Acumen Pharma is involved in the development of a new drug, ACU193, for the treatment of patients with Alzheimer's disease. What does that mean for the patient at home? How would they expect their treatment to differ, or how might their outcomes differ with a medication that worked like this?
Yeah, so as we think about when one or more of these monoclonal antibodies does become approved, and hopefully that will happen, again, people can continue taking their older symptomatic drugs. They don't have to stop those. But what would happen when these types of drugs are available commercially is that probably once a month, maybe once every 2 weeks, the person would additionally go into an infusion center and have an infusion of one of these monoclonal antibodies. Now, there are monoclonal antibodies that are given for things like Crohn's disease, other disease types that people have these sort of regular infusions. So that by itself is not really unique, but there's nothing like that available for Alzheimer's disease right now. So what you would expect to see with that is, again, a slowing of disease progression. In other words, you can continue to do things like drive a car, travel, recognize your grandkids for longer than you would have without one of these disease-modifying drugs. Now, unfortunately, I don't think it's likely that in the near future anyway, we'll be able to stop progression. That would be great. And it may be in the future, by using combinations of these medications, we could do that. But at least at this point, I think if you talk to most people and they said, well, you're going to be able to recognize your grandchildren for 6 months longer than you would have, I think most people would consider that to be valuable.
I have friends who have loved ones with Alzheimer's disease, and a parent with Alzheimer's disease, and when they go to visit the parent says, you're so nice to me, who are you? They don't even recognize that this is their own child. So I would imagine that anything that could forestall the progression of this horrible disease would be welcomed by patients all over.
Yes, that's exactly right. It's just a tragic disease when you have people in their later years who are just not able to have any kind of quality of life. And obviously it's difficult for typically the sons and daughters of the patients too. So and again, most people have been touched by it. It's not uncommon. It's the 6th leading cause of death in the United States currently. And if you look at people over age 65, it's the 5th leading cause of death. So it's very common, and most people in one way or another have been touched by the disease.
And the prevalence of Alzheimer's disease is expected to continue to rise as baby boomers get older. Is that correct?
Yes, the prevalence will continue to rise because it is age-related, and the population becomes older. So currently in the United States, there's over 6 million people with Alzheimer's disease. If there's no way to actually forestall the emergence of dementia with one of these disease-modifying drugs, so if nothing changes, by 2050, there will be probably 3 times that many people, so 18 million people in the United States. The cost to Medicare in 2050, if nothing else changes, would be over $1 trillion. So this is a disease that can actually bankrupt a lot of countries in the world.
Yeah, it really is staggering when you think of the toll that this disease takes on the person, the patient, on families, and also on society in general.
That's true. It takes a very great toll on many different groups of people, and it's a huge cost to society, partly in terms of care for the patients, but also in terms of lost work and that sort of thing from the caregivers.